You're watching Cetome TV. Knowledge is power.
So, if there's like one thing that you kind of are most excited about what you're doing now or what you're seeing in cancer treatment and testing development, what would that be?
Well, that's a great question.
Thank you.
We've started with chemotherapy. Chemotherapy has come and now it's leaving us. Chemotherapy randomly kills any cells that happen to be reproducing. We've gone into targeted therapies. Targeted therapies are based on genetic mutations. Immunotherapy came along, and we were one of the first companies in Canada to use immunotherapy on patients. We use it all the time, and we have a bunch of diagnostic criteria to determine which patients are going to respond. We've had some amazing responses, patients that are still cancer-free many years later, based on our criteria. And so that was a great discovery. And now the next two areas are going to be the biome. So in other words, the bacteria and the different bacteria and viruses that live within our body, finding out how they affect cancers, because they do affect cancers, they cause cancers, they regulate cancers. There's all kinds of different situations. And then the epigenetic changes. So the epigenetic changes, so what epigenetics is in short, is epigenetics is the process where we can use the same DNA. So in other words, the genomes in our body are all the same. All the cells have the exact same genome. Not exact, it changes over time, but roughly they have the same genome. So how we get a different cell, like a hair cell or an eye cell or a skin cell or a bone cell, is that certain genes are turned on and certain genes are turned off. So we have this backpack information. We have this massive genetic information, but each cell only uses a small portion of it. So it uses a portion of that to, we have genes in our body to grow wings. We could grow wings if we wanted to, if we had the right combination. It's called WINT, wingless. So epigenetics is the process where those genes are either turned off or turned on. And how long they're turned off for and how long they're turned on for. And so our cells create different tissues by turning on different genes and turning off different genes at different time points. And that is what epigenetics is the control and the regulation. And one of the primary regulators of epigenetics is a process called methylation. And the control regions surrounding a gene have what's called a methyl tag. And this methyl tag allows the DNA polymerase to not bond or bond depending on the situation. So that's one of the processes. Also acetylation, and that controls methylation and different processes. But epigenetics is the big forefront. However, what's got me most excited is obviously exosomes. We didn't see that one coming. It just got us, it blindsided us. And it explains so much.
Oh yeah, go ahead, please.
So knowing now that cells release little packets of DNA and chemicals and biomolecules that actually travel around like zombies and convert other cells. And so what we now know is not only can we monitor these things, but there's all kinds of people working on drugs that target exosomes.
Yeah, modification.
That's going to stop metastasis in its tracks. So this is the new frontier.
Yeah,
this is going to be really something.
That's exciting. So getting it kind of before it even has a chance to leave the mothership, essentially.
Totally, yes.
Woohoo!
Yes.
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 That is exciting. That is definitely exciting.
So that's what's got me most excited.
Yeah.
Thank you for watching Cetome TV. Subscribe below and stay informed.